Hi, I'm Dr. Erin Ducat, a sports chiropractor with Ducat Chiropractic and Sports Medicine here in Bloomingdale, Illinois. Today, I'm going to teach you a bit about shoulder anatomy and about what normal, healthy range of motion is in the shoulder. So your shoulder joint is actually comprised of 3 different joints, all working together to help your shoulder move well. You've got the regular ball and socket joint here called the glenohumeral joint. So that's the one that allows you to rotate your arm around like this. You have the acromioclavicular joint, which is where your scapula, your shoulder blade, attaches into your collarbone. That joint's actually located all the way up here. And that is the joint that you use primarily if you're lifting up and overhead, and also allows you to externally rotate your shoulders. The last joint of the shoulder is kind of a weird one. It's called the scapula-thoracic joint. It's not a joint in a traditional sense like the glenohumeral joint or the acromioclavicular joint, but it's a connection point between where your scapula rests on your rib cage or thoracic cage. It's actually comprised of connective tissues and muscles and is an area that causes a lot of problems for lots of individuals. So when all 3 of your shoulder joints are moving well, you feel great. Your shoulders move great. You have a lot of lifting power. You're able to pull and press in both the horizontal plane and up and overhead. But when one of those joints or more either moves too much or not enough, that's where shoulder pain comes from. And then that's when you become a patient here at my office. So I wanted to teach you a quick screening test that you can actually use on your shoulder and on your family members to make sure you've got good, adequate shoulder flexibility and health. It's pretty simple. All you do is you take your hand and you reach back behind your head over to the other shoulder blade. So you should be able to touch that other shoulder blade. Please note that I'm not allowing my head to come forward like this so I can reach. I'm able to keep my spine nice and long. And then you should be able to do the same thing on the other side. Also, if you have any pain or discomfort as you're doing this motion, that's definitely a sign of a failed test and a reason to go see your sports chiropractor. So once you check reaching up overhead, the next thing to check is actually reaching down and underneath towards the other shoulder blade. You should be able to reach all the way across and be able to touch that other shoulder blade. It's normal to have one side that's a little bit more flexible than the other, but you should be able to touch the tip of both shoulder blades without any type of pain or discomfort. Now, if you do this test and either you can't make it all the way over, maybe you're jutting your head forward, or there's a lot of pain or discomfort reaching around, that's a sign that you need to see your sports chiropractor. You need to get evaluated, see what joint is maybe moving too much or not enough so you can nip this problem in the bud so you don't end up with other shoulder issues like arthritis, rotator cuff tears, tendonitis, or bursitis. This video is actually the first in a series of videos on shoulders. So if you're interested in learning more about shoulder health, common shoulder conditions, and how to treat shoulders, please stay tuned here in the following weeks. If you have any other questions or concerns, check out our website at ducatchiropractic.com. It's spelled the D-U-C-A-T, chiropractic.com. Thanks.